Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
I have had major improvement in my baseline now compared to where I was 5 or 6 years ago. A lot of that has come from just the huge advancements in treatment options that have become available in recent years. I was kind of ready to give up. I was like, I think I'm out. I might just have to get used to living with this kind of pain. I had tried probably like 15 to 20 different medications by that point. But when I had the opportunity to try these new treatments, I was like, let's do it. Sign me up. Nothing else worked before. Might as well see if any of these do.
Welcome to Talking Head Pain, the podcast that confronts head pain head on. I'm your host, Sarah Shaw, Senior Manager of BIPOC Community Outreach at the Global Healthy Living Foundation. I have been living with chronic migraine for almost 10 years, and I'm very open about navigating life with my chronic disease journey as well as my experience living with anxiety. This podcast will be a window into other patients' lives as they navigate their own journeys living with chronic pain, migraine, and mental health. And I'm joined today by Taylor, who has been living with chronic migraine for over 10 years now. Taylor, welcome to the podcast.
Thank you so much for having me.
I like to start off the show by asking people what's been their worst migraine attack and walk us through that.
Oh, gosh. Well, I feel like any migraine attack that ends in the hospital, ER is a bad one. I've had a number of those, but I think probably the scariest, worst attack I ever had was one where I really couldn't tell if it was a migraine or a stroke, which generally good advice I've received is in that case, you definitely want to go get checked out. But, I had the whole drooping on one side, could barely get my words out. The pain was so intense that it just felt like being in another dimension. And fortunately, my nausea has really improved in recent years. But at that period of time, I had some major GI symptoms as well. So that was a rough one. And then unfortunately, sometimes going to the ER is a problem in itself. It's not exactly a pleasant experience. I kind of just had to white knuckle my way through that one.
Oh, yes. I have been to the ER once and only once for migraine and just will not go back just because of the experience. And we talk on the podcast a lot. I think every other person talks about how the ER is not a good place for people with migraine. It's very loud. There's bright lights happening. It's not a good environment when you're someone who just wants to curl up into a ball and be in the dark, right?
Exactly. Yeah, I was just there Friday. Not nearly as bad of as an attack, but just kind of trying to deal with a flare, and was so fortunate that it felt like the hospital staff I was working with was a little more aware. They offered to turn the lights off for me. If they had to turn them on, they gave me a washcloth I could put over my eyes. They were much more migraine literate. Yeah. And I think that kind of has something to do with what we're talking about today. So
I was going to say the same thing. I think we've come a long way, and I'm going to get into this a little later on the podcast about stigma. Actually, no, I'm going to talk about it now because it kind of flows into the conversation, right? You were mentioning about the difference between the worst migraine attack that you had where you were at the ER to one that, unfortunately, you were just at the ER recently, but had a better experience. And it's the little things, like you said, putting a washcloth over your head, them letting you know when they're going to turn on the lights and whatnot. Just those little changes, speaking quieter, putting you in your own room, those make a difference. And then also being educated on what are the newer and better migraine treatments to be on versus what has been done, 20, 30, 40 years ago. And so I think there's still a long way to go, but I do see an improvement. And speaking of stigma and knowing that you've been living with migraine for over 10 years now, what are some tips that you can share in terms of helping break that stigma that is put on, the word migraine and it being not just a bad headache?
Yeah, I would say that as much as it has been a journey to get to this place, living your authentic self is really one of the best things that you can do. Sometimes I feel like there's this instinct when you're meeting new people, you're in a new job, whatever the situation might be, to try to hide and mask your pain, mask your symptoms. And in a lot of ways, I feel like it comes back to bite you. I think especially socially, I found it so helpful. If I'm, making new friends and connections, I'll just say, hey, there might be times that I have to cancel our plans. It's nothing personal. It's not that I don't like you. I'd love to hang out, but this is just my life might look a little different. And I found that people have been much more receptive to that than maybe the alternative of, oh, sorry, I'm not going to be able to make it today, again and again and again.
Yeah.
And just by being honest, it allows us to make plans that are more conducive to, whatever my threshold is for stimuli. And same with jobs too. That's, I think, a little more scary just because you never want to lose an interview or an opportunity. But I've just found in my more recent opportunities when I was looking for a new job, I was moving, whatever else, I really sought out employers that had something on their application or their website about being a disability friendly employer. And I was just upfront about it from the beginning. So I know myself well enough now to have a pretty good idea of what my abilities are, what I bring to the table, and really selling that the best that I can, but just also saying, and here are some things that I need. So yeah, it's made a big difference just to own it the best that I can.
That's so encouraging. And I think exactly where we want all migraine patients to get to that point. And I know you mentioned it being scary, kind of, like admitting that you live with a chronic illness that does impact your life. And you talking reminded me of something that happened at a previous employer where I was like, shouldn't I, should I talk about it? And it was this back and forth in my head. And I was like, what do I have to lose? It's better for me to talk about it now just to see how they're going to react. And in it, I told them I was like a migraine advocate and talking about how it impacts my life. And the first question out of her mouth was, well, does it impact your work? And right then and there, I was like, okay, we're going to have an issue. Like of just like you don't get it. And I did work there, but there was just a lack of understanding and empathy versus like where I work now at GHLF and just this understanding of, okay, we know you have a chronic illness. We'll make accommodations. I can work from home. If I need to lay down for 30 minutes while I take a medication to let myself feel better, that's what I'm going to do. And that's how I'm going to show up as my best self. And I think what you were saying really, really aligns with that. And that's the goal. That's what I want everyone to experience. And I think addressing stigma and having conversations like this is a big part of the puzzle.
Yeah, I would completely agree. And to what you were saying, if that gives you the kind of heads up that you need to know, oh, maybe this employer is not going to be a good fit, or this relationship might be more superficial than I thought it was, or whatever feedback that you get is really useful information, because at the end of the day, like, we have to protect our health and our energy too.
Absolutely. And I just want to make a note what I said earlier when they asked about, oh, will it impact your work? It does and it doesn't. But what a lot of people get wrong is, okay, we're just not going to be good workers. And that is the furthest thing from the truth. Like, I know if I need 30 minutes to 40 minutes to let my medicine kick in, I'm going to show up so much better at work and put my everything into it. I just need accommodations. And so I think that's the understanding that I want to see happen in terms of people who live with just not even migraine, but like chronic illness in general. We are such valuable members of society who contribute to a lot. We just work differently. And if we're able to navigate that with people, magic can happen. And I'm slowly starting to see it, like you mentioned, like having organizations talk about disability and stuff like that. That's the little icon to know, okay, this is a good place for us. I know from us chatting briefly, you've had to advocate to get your migraine care that you deserve. Do you mind sharing some ways that you've advocated that might be helpful to our listeners?
Sure. I would love to start just by maybe painting a picture of the dire circumstances of where it began, because I think this is just so relatable for most patients when we're kind of starting out completely in the dark, not even really understanding our own condition, what works, what doesn't work. We are totally putting our lives in the hands of our care practitioners. And so, I had kind of started out in my just PCP, like my general practitioner's office, trying the very basic, most rescue medications. We didn't really quite get into preventatives. That was the point where they decided, like, oh, we should probably turn you over to a neurologist. And the first provider that I saw was so old school. I mean, I feel like he just managed to avoid picking up a journal article or, watching a news story for years on migraine. And so he had the advice of, oh, just take these over-the-counter medications, these anti-inflammatories, these things that we come to learn the more that you deal with chronic migraine are just going to set you up for more problems in the long run.
Mm-hmm.
So I inevitably developed the rebound headaches, the medication overuse headaches, and the advice at that point was, oh, well, you're taking it too much. We need to just stop this cold turkey. So I'm like, what? We're going from take this the second you even think you have a headache going on to just avoid it completely. And it was devastating. It completely broke my trust with that provider. That was the point at which I decided to switch to another neurologist. And this was the sweetest guy, so willing to try new treatments, exhaust all the options, but I just wasn't getting better. And I always have to tell this story to people because it's just such a pivotal moment in my migraine journey. I went to his office and was just, I was in college. I was losing all my friends. I was making awful grades. My life was just completely spiraling out of control. And I'm emotional. I'm crying. He starts crying.
Oh my gosh.
And then 2 weeks later, I get a letter in the mail saying that he had left his practice. And so I'm thinking, oh no, did I just break him? Was it me? I'm sure it wasn't, but just looking back on where my patient journey started, I came to learn through those experiences. At the end of the day, it's me. My neurologists are going to be the ones to write the prescriptions and help me move throughout my treatment, but I'm the one who has to keep this train on the tracks. I need to really kind of take responsibility as much as I can, and as difficult as that can be when you're in the throes of migraine. So I began doing things like tracking my attacks and triggers and responsiveness to medication the best that I could, so that when I went to my appointments, I had some good solid data to show. Anybody who has been part of this process knows that you're going to get the questionnaire that asks you, how many headache days a month, rate the severity. There's a lot of numbers. So if you have something that you can look back and just kind of plug in that way, it's so helpful. I also have taken it upon myself to try to educate myself the best that I can as a patient. As lay people have very different levels of ability in understanding that kind of information compared to our providers. But I've done some really great webinars, online courses, support groups, all these different kinds of things where I could just get an idea of the lay of the land. And I could show up to my appointments ready to ask questions and ready to say, hey, this didn't work out so well. Might we be able to do this? Might we be able to do that? And then, of course, there's always the component of how do we pay for all these treatments? And so it might be that we have some kind of private commercial insurance. We might be working with some kind of government funded source. Whatever that may be, you have to kind of get an idea of how it works so that then you can help push things through when they get stuck. So that's kind of a ever evolving effort. I think I have the kind of leg up right now of actually working for an insurance company. So that's really helped me get the inside scoop on some of these things, but just educating for yourself and speaking up the best that you can, becoming part of your treatment journey as an active participant.
Taylor, what I'm hearing is you really took the reins and you were like, fine, or quote unquote, where I'm at is not okay. I deserve better. I deserve better treatment. And given that, I think you mentioned you were on better treatment now, or at least maybe you're feeling better now versus where you were 5-6 years ago. Can you walk us through how you went through that with your current provider? I know with me, my headache specialist and I go over shared decision making. She'll bring something up, I'll bring up something, and we'll come into the middle to find an agreement of what will work for us. And I'm just curious if you've experienced that.
That is so promising to hear that more providers are starting to take that kind of approach in involving patients and making decisions for themselves, which makes a lot of sense. We really should at least have one hand on the wheel with them as we're kind of driving down that road. I have had major improvement in my baseline now compared to where I was 5 or 6 years ago. A lot of that has come from just the huge advancements in treatment options that have become available in recent years. And I was at a place right about that time where these really started to become more accessible, all the different treatment options. I was kind of ready to give up. The same way that I got the letter in the mail from my doctor that he was out, I was like, I think I'm out. I might just have to get used to living with this kind of pain. That might just be my normal for the rest of my life. And that's devastating, but also in some ways feels more feasible than just the constant fight to try to get better and not see any improvement. So I luckily had kind of kept one foot in the migraine education space enough that when I started to kind of hear the buzz about, oh, have you tried this? Have you tried that? There's this new thing that's coming, where I was like, I think it's time to go back to the drawing board. I had tried probably like 15 to 20 different medications by that point. And these were, again, the more like old school off label, I think they kind of call them, treatments where it wasn't developed for migraine in most cases. Yeah. So they really are just throwing things at the wall and saying what sticks. But when I had the opportunity to try these new treatments, I was like, let's do it. Sign me up. Nothing else worked before. Like, might as well see if any of these do.
What do you have to lose, right? I was at that place too.
Exactly. Right. Yeah. And some treatments are more or less pleasant than others. So you kind of have to buckle up and just say, all right, I know this is what I'm getting into by trying these things, but let's give it a shot. So I'm so glad that throughout the course of like the transitions with my different neurologists and everything that was happening on that end, I did still continue to see the same general practitioner that had initially given me the kind of like first line of defense prescriptions. And so they were always so empathetic and always so encouraging about, let's try to do whatever we can to just get you some relief. And so when some of these new treatments hit the market, that's the first place that I went back to was my GP. And I also had a huge benefit where his wife was a long time chronic, intractable, I've had plenty of episodes that were intractable, but that was just her status quo. So he knew firsthand what it was like for her. She was able to start some of these new treatments, saw a huge improvement. And so when I went to him and just said like, hey, this is where I want to kind of try to take this, he was like, absolutely, let's do it. So he was able to help me access some of those right away. And then as time went on, more treatments came out. It was kind of like, okay, let's get you back to neurology. I had him move since then. So unfortunately, he's no longer my main general practitioner, but I've had some really fabulous other ones. And I'm also now working with a really great neurologist who is in the same mindset that I am, where any amount of pain that I'm experiencing is not okay. There's no reason that I should be living that way. And so I could have the mindset where I'm like, yeah, I've improved a lot. Maybe this is good as it gets. I'm kind of like, no, like I've seen what it's like on the other side. I've seen what it's like to really have my life just change so drastically. And I want more of that. And my neurologist is very much the same way.
It's so refreshing to hear for multiple reasons, Taylor. I'll try to do this in order. One being that your general practitioner was kind of the link to wanted to like collaborate and like work together with you. As we know, number one, like there are not that many headache specialists in the US, and there are not as many neurologists who have an understanding of migraine. And so looking at that right off the bat, where do people go? They go either to the ER or they go to their primary care doctor. And so having our primary care doctors educated about these newer medications and you being able to have a conversation with him. I know personally, whenever I go to see any primary care doctor, whether they're new or old, I'll list out my medications and there's like, what's this for? I'm like, like, that's for migraine. Was it, that's for migraine too. Like having just even that is like a form of advocacy. If I am at least making some sort of impression to be like, if you have any other migraine patients, maybe mention, these for them, because there's too many things out there that's hard to keep track of. And now, like you said, we have this, I don't want to say plethora, but we have all of these newer treatments and medications that, like you said, you are responding so much better to. And I was at a very similar point where I was at an old neurologist and I just started crying because I was just like, I can't keep living this way. I can't. I was struggling at work. It was hard. It was difficult. And just moving from that into seeing like my current neurologist where she's like, we don't care. We're going to try just knowing that you had someone that's not going to give up on you makes like a huge difference. And I think you're also like a testament to that as being the patient who tries their hardest to educate yourself about what's going on, because unfortunately there are too many things, and being able to bring something to the doctor. Like I remember when I first used the term CGRP to my neurologist and they were like, look at you. And I was like, there's more where that came from.
Yeah, hit him with a monoclonal antibody or whatever you say.
Exactly. I'm like, we can talk these terms all day. Let's go at it. But no, it's important. It's important to advocate. It's important to also knowing that migraine is an invisible illness that's already heavily stigmatized as just a bad headache or, oh, it's stress and all of these like terrible things that are associated with it. And then you add being like a woman or a non-binary person on top of that, we're batting out there having to go hard. And conversations like these are really important to help move the needle forward. You kind of touched on this, but what motivated you to make these more positive health outcomes? I know when we get to that dark place, like I suffer from anxiety and other mental health issues. Like, how did you get to the point where you were like, I deserve better. I deserve more?
Yeah, I was just incredibly depressed when I was at my lowest low with migraine. And I mean, like you'll see all the time, like the inspirational, like, hey, you got out of bed today, you took a shower. Like that was very much true when I was just in full on survival mode. I think when you start to experience the really small successes and the very little changes that give you some insight that life can be better, it's like a snowball effect. It can be a really, really slow rolling snowball effect. But I found that, whatever it was, that like little voice inside that just said like, hey, this could be it. Listening to that, starting to have more and more pain-free or manageable days, seeing such a huge reduction in my nausea and, the other kinds of symptoms that were so common for me with migraine. It was just like I would have these little windows open up where suddenly like something was possible that wasn't possible before. And we know with migraine, lifestyle and the choices that you make every minute of every day can play such a huge part in your condition.
Absolutely.
So yeah, it was things like finally having enough energy to make a good, nutritious meal instead of just pulling something out for the freezer, finding more ways to like incorporate movement into my routine. All these things where it was just like compounding factors to I felt a little bit better. This changed help, that changed help. And so it was really hard to kind of like pull myself out of the deep dark hole at the beginning. But once I did, it was just so validating and encouraging to just keep going. And so when I find myself in kind of like a flare like I've been experiencing recently, I'll be honest, the first reaction is always panic, right?
Mm-hmm.
I'm looking at my migraine tracker. I'm seeing this huge increase in days and severity and, return of some symptoms I haven't had in a long time and some patterns that I thought I'd kind of overcome. And so my brain just goes, high alert, like we don't want to go back to where we were before.
Yeah.
Like that. It's unimaginable. I don't know, honestly, how, me or anybody else that has gone through that experience makes it through. It's just so soul crushing and awful to live through. But I kind of just keep reminding myself, if you can just get a couple more pain-free days, if you can just get back to the point where you're exercising a little more, it's just kind of trying to keep that progress. And the same way that I almost had to like relearn how to be happy and how to feel good. Like when I was coming out of that really depressive state, I started going to therapy more then than I did when I was actually depressed, because I had to learn how to let that go. It was something where I just was always waiting for the other shoe to drop, just living in that constant state of like, this can't be real. This can't be right. I can't be feeling this good for this long. And it was really helpful for me to learn how to just reframe some of those super ingrained thought patterns that I was living in. So that's just kind of the mentality I've tried to keep, and how I tried to keep tackling these flares when they come.
Absolutely. I appreciate what you shared and being vulnerable about like depression, and talk about mental health a lot on the podcast, and how pain such as migraine, whether it's arthritis or whatever, how that impacts our mental health, and having resources and tools in place to work alongside that are crucial. But the reality is being pain sucks. Like, I'm not going to sugarcoat it. And so anything that we can do to bring relief to patients, whether they're migraine, arthritis, IBD, we want to do so. I just want to thank you for coming on the podcast, sharing your story, sharing your experience, and just letting us get a peek into your life. So Taylor, thank you so much for coming on.
Yeah, it's such a pleasure. And I would encourage anybody who has the opportunity to do the same. It's only going to help me be a better advocate. So thank you so much.
Thank you for listening to this episode of Talking Head Pain, the podcast that confronts head pain head on. This podcast was made possible with support from Lundbeck. If you have any questions, thoughts, or suggestions for us, you can send us an email at podcast@ghlf.org. If you like this episode, please give it an honest 5-star rating, write a positive review, and spread the word by sharing with your friends and family. It'll help more people like you find us. I'm Sarah Shaw, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.